Coronaviruses are a type of viruses that typically affect the respiratory tracts of birds and mammals, including humans. Doctors associate them with the common cold, bronchitis, pneumonia, and severe acute respiratory syndrome, and they can also affect the gut of the human body. These viruses are typically responsible for common colds more than serious diseases. However, coronaviruses are also behind some more severe outbreaks. Over the last 70 years, scientists have found that coronaviruses can infect mice, rats, dogs, cats, turkeys, horses, pigs, and cattle. Sometimes these animals can transmit coronavirus to humans. Cold or flu-like symptoms usually set in from 2 to 4 days after coronavirus infection and are typically mild. However, symptoms vary from person to person, and some forms of the virus can be fatal. Symptoms include sneezing, runny nose, fatigue, cough, fever in rare cases, sore throat, exacerbated asthma. There is no cure, so treatments include self-care and over-the-counter medication. People can take several steps, including resting and avoiding overexertion, drinking enough water, avoiding smoking and smoky areas, taking acetaminophen, ibuprofen, and naproxen. For pain and fever, using a clean humidifier or cool mist vaporizer. Coronaviruses can spread in the following ways. Coughing and sneezing without covering the mouth can disperse droplets into the air. Touching or shaking hands with a person who has the virus can pass the virus between the individuals. Making contact with the surface or object that has the virus and then touching the nose, eyes, or mouth. Some animal coronaviruses, such as feline coronavirus, may spread through contact with feces. However, it is unclear whether this applies to human coronaviruses. The National Institutes of Health suggest that several groups of people have the highest risk of developing complications due to coronavirus. These include young children, people aged 65 years or older, women who are pregnant. To prevent transmission, people should stay at home and rest while symptoms are active. They should also avoid close contact with other people. Covering the mouth and the nose with a tissue or handkerchief while coughing or sneezing can also help to prevent transmission. It is important to dispose of any tissues after use and maintain hygiene around the home.